When trying to slow or even reverse the signs of aging, most people focus on the face, but that is not the only area that needs attention. So Dr. Ann-Therese Stubbs is here with things that you likely never thought of, and of course ways to reverse the damage, because that's what we are trying to do. Dr. Ann, good to see you.
Thanks for having me.
All right, so you preach, first of all, relentlessly and for so many good reasons, about the need for sunscreen year-round. What are some of the areas people typically forget, though, to use that on?
And that's a wonderful question, because number one, year-round is important, especially when it gets gray in the winter months. People don't think they're getting the UV damage from the sun, but they are, especially driving in a car. Areas that people forget are their neck, the décolleté area, their hands. These are areas that I hear from my patients, wow, I was taking great care of my face. I've always had my SPF in my foundation or on my face, but I've kind of forgotten about this area. And the décolleté area is an area that ages a lot of women with pigment, the fine lines, the wrinkles, and the little creases that kind of come with time.
And I think the thing that you point out too is then you notice a vast difference between those areas because they are so close to each other, right?
Exactly. People feel like, oh, I have this cutoff at my chin where my skin looks good on my face and maybe crepey on the neck or the décolleté area, and that's an area where if they're getting into the summer months and wearing, camisoles or even wearing a low cut or a V-neck dress, they feel like, oh my, the pigment's showing here.
Right, exactly. And that's the thing, you can get those same things, that brown spots, the dull, the wrinkly skin, that stuff that could happen on your face can happen on those other areas.
Exactly. Sun is a big proponent of that, and then aging, and then sometimes people sleep on their side too, and that can cause some creasing in the area there on the chest too.
All right, let's talk about some of the tools. We've got up this picture with Fraxel, which is a laser.
Yes, Fraxel is a non-ablative laser, meaning it does not peel the surface of the skin. It's done in a series of 4, and it builds the collagen and takes the pigment off. And so this picture you're seeing is after 4 Fraxel treatments. Each one's a month apart. And so that's probably about 6 weeks after the last treatment when we wait for some of that collagen to build.
The true results. Okay, next the IPL. So what is this good for?
IPL is intense pulsed light, sometimes called BBL or broadband light as well. But this is a flash of light, a lot of different wavelengths that target both the reds and the browns. This also builds collagen over time too, but the thing patients notice right away, even the week or 2 after, is the browns tend to get browner and then they fade or they flake right off. So can easily get the pigment gone quickly.
Another effective treatment, and it kind of says it in the name, Clear and Brilliant.
Yes, Clear and Brilliant is another non-ablative laser. I like to call it Fraxel's little sister. It's not quite as deep as the Fraxel laser, but the same type of technology, little dots of energy just kind of put into the skin so it does not ablate the skin. It doesn't take the skin off or peel, so there's not much downtime. You're just a little bit red that day. You can put makeup or sunblock right on, so it's an easy, low downtime procedure.
All right, something else that many people haven't heard of, and you were singing its praises to me right before we started today, but it's a pad.
Exactly. And so a lot of times people feel like they just want to combat the wrinkles on the skin, and you can do that even without the powerful laser treatments. If people want to just kind of dip their toe in and start gently, we usually recommend very mild Retin-A cream, and then this Decollete Pad is in the realm of $30, and it's placed on the chest at night. It's made of silicone. It's very moisturizing. One pad is kind of a sticky pad, and if people are side sleepers, you place this on at night. If they roll on their side, it prevents the skin from kind of folding. If you think about a piece of paper, if you fold it over and over again, you're going to get that crease.
Yeah.
Same thing happens with the skin. So if you think night after night, you're someone who sleeps on your side, you're going to get those nice little creases there. So it's a very simple and a very inexpensive solution, very safe. Nobody's allergic to it. And one of these little pads lasts maybe about 3 to 4 weeks, and then people can toss them and kind of get a new one. But it's a simple solution if people aren't ready to kind of dive in to the lasers just yet. But we can start with the products and the little silicone pad and kind of step up to whatever the needs are.
And with so many options, we know that you offer free consultations, which is the best first step. And then today, 20% off these treatments.
Yes, this is a perfect time to address kind of the neck, the décolleté area, because we're all bundled up in the winter. So even if you are red for a day, it's easy to hide.
Exactly. I love it. All right, Ann-Therese Aesthetic Medicine. Just give them a call. Dr. Ann, thanks for being here.
Thanks for having me.